Hey guys, what's up? Well, now I'm going to talk to you about the post-op instructions for the procedures we talked about. So first off, we're going to talk about the post-ops for sealants. Now, as Melissa explained to you before what that was, now I'm going to tell you the post-ops. So, first of all, your child should refrain from eating ice or hard candy because that could fracture the sealant, which would not be good. And also, it's also recommended that you schedule regular dental visits so that the doctor could make sure that the sealants haven't fractured and they're in place. And then the next thing we're going to talk about is the fluoride treatments. There's a kid, and he has a fluoride thingy in his mouth. Alrighty. And then, so the post-ops for the fluoride treatment is, it is recommended that your child does not brush or floss for 4 hours. And also, you don't want them to eat anything hot, sticky, or chewy also for 4 hours because that's not really good and the fluoride can't take its full effect. And then, so the next thing we're going to be talking about is the space maintainer. That's what a space maintainer looks like. You could see the metal inside the lingual on the mandibular teeth. Okay, so the post-ops for the space maintainer is that you don't want to be eating or drinking for 30 minutes after it's cemented, and you also want to have soft food only, and you don't want to have your child manipulate the appliance, so you want to keep their fingers out of their mouth, and it should not cause significant pain, but since it was cemented on the molar bands, it may slightly impinge on the gums, which could be discomforting for the child, but just for a few days. And let's see, with larger appliances, your child's speech may be a little, not very good, but they will be fine, because they will speak normal speech whenever, they get accustomed to the appliance and stuff. And then also, you want to continue normal oral hygiene practices, and you want to brush really well around the appliance. And also avoid all sticky or chewy candy, and don't give your children gum because that is not good for it. Alrighty, and then you want to check your child's appliance daily when you assist with their brushing, if you do that. And then if the appliance feels loose, make sure that you retain the maintainer, and then call your dentist. Alrighty, and then the last one we're going to be talking about is crowns. So, and here's some stainless steel crowns. So, isn't that cute? Oh, cute. Alrighty. And what about these is they've been shaped to fit your child's natural tooth to make it strengthen it until the tooth naturally falls out. And the gum tissue surrounding the tooth may appear to be bleeding, but that's normal, so that's fine. And then, let's see. You could notice a purple or gray color around the gums, but that's normal and it will subside over time. Alrighty, well there's the post-op instructions for the procedures that we talked about. And now I'm just going to show you the proper way of oral hygiene. Now, the proper way to brush your teeth, there are 3 major ways that are used. One way is called the Bass method, in which the brush of the toothbrush is at a 45-degree angle from the teeth, and then you just brush back and forth. And a Phones method is whenever you are against the surface of the teeth and going in a circular motion against them. And then the last method is a modified Stillman, which is actually a combination of both of those. So you go along the gum line in a 45-degree angle and then make circles. And the next thing is flossing. So when you floss, you want to go above the gum line of the teeth into where the free gingiva is hanging off, and you want to do a seesaw motion in between and go back down and to the other side and do a... Okay, bye!